Welcome to Health Focus. I'm your host, Dr. Scott, and remember, here at Health Focus, we focus on your health. November is Hearing Awareness Month, and this is a really important subject. Believe it or not, only about 1 in 5 people who would benefit from a hearing aid or other assistance actually uses one, and the average person waits as long as 7 years before seeking help with hearing loss. And we're seeing this more and more as the baby boomers get old. And it's really a problem, not just for the individual, but for the individual's entire family. And we're here today to talk about hearing loss and also tinnitus, or ringing in the ears, with our guest, Dr. Gene Dice. Dr. Dice is with the VA Northern California system and is an audiologist with a great deal of clinical experience and expertise. And Dr. Dice, it's really a pleasure to welcome you to Health Focus.
Thank you. Happy to be here today.
Maybe you could tell us a little bit, first of all, just what an audiologist does and what the training is to be an audiologist.
Sure. So audiologist, the entry level is a doctorate degree. So that is typically an AUD, which is a clinical doctorate in audiology. So that's a 4-year program beyond a bachelor's degree, or a PhD. And so audiologists specialize in diagnosing and treating hearing loss and also balance disorders.
And you're busy with that practice largely with a population of veterans.
Yes, very much so.
So I'm guessing your patient population is both men and women, but predominantly men, probably, even in this day and age?
Yes, we're getting more female veterans, I think, more younger veterans as well.
And you have several audiologists who work with you, I understand.
Yes, so VA Northern California, we have 6 clinics. I'm located at our Martinez clinic, and we have a full staff of audiologists there.
Being a veteran myself and having performed compensation and pension evaluations myself at the same facility you're at, in fact, in past years, I'm always surprised at how severe hearing loss can be at a young age in an individual who's had what we call acoustic trauma or damage to the ears. And it's amazing how great that need is for diagnosis and treatment. Wouldn't you agree?
Oh, absolutely. Especially with some of our more recent conflicts, we're seeing younger and younger veterans exposed to IED blast or other type of blast traumas, as well as your other kind of run-of-the-mill military noise.
And my own practice tends to be more in geriatrics now, and obviously hearing loss is a problem for the elderly. These statistics that I was citing, indicating that perhaps only 1 in 5 people who would benefit from a hearing aid, for example, or hearing assist device gets one, do you think that's the case? I mean, that seems like it's really a low number of people who are really availing themselves of your services and the technology that's out there.
Unfortunately, I do think that is true. We see that quite a bit in the VA as well, especially if they've had maybe a progressive noise-induced hearing loss over the years. They've kind of learned to adapt to it. Certainly there's a bit of a stigma with wearing hearing aids or admitting that they have a problem. Maybe they're a little bit in denial that they even have a hearing loss. So yeah, there's a lot of barriers.
And in terms of the stigma of wearing a hearing aid, maybe you can enlarge upon that a little bit more. Actually, this is a good time to mention this article from the Wall Street Journal that we were discussing off air. Hearing aids get smarter. And this is from September 16th, 2019. And I see that the hearing aids from the 1970s practically look like Sony Walkman toys or something, and really clunky and huge and often going in one ear. And the newer hearing devices are actually much smaller, and some of them are even equipped for Bluetooth technology and monitoring vital signs or other functions, I think, if I'm not mistaken. So we've come a long ways, right?
We've come a long ways. Even since I've been an audiologist, I'm familiar with some of those older body-worn hearing aids. So nowadays, hearing aids, they can be very small. Like you said, they do have the Bluetooth wireless connectivity in them. They can connect to their smartphones. So I certainly think that that's helping with the stigma of wearing a hearing aid.
You know, I've discussed this with ear, nose, and throat doctors, for example, and one of them told me that, at least historically, hearing aids tended to stigmatize people because when people saw hearing aids, they would often think, well, this is an individual who had meningitis or developmental delay, and they would assume that because there's a hearing aid, there may also be some cognitive problem, and that would lead to stigma. And of course, we shouldn't stigmatize people who are cognitively impaired either, but do you think that's part of the historical issue with the stigma of hearing aids?
I think that's correct. And like you said, it just, people think that maybe not just that they have a hearing loss, but they're a little slow, because sometimes I'll see people talking to hearing impaired individuals, and they're not only talking louder, but they're slowing their speech down.
Right.
Like they think it's more of a comprehension issue. So yeah, there's definitely a lot of that going on.
And I guess also we should mention appearance, because I think I said the baby boomers are getting older, but I probably should have said they're getting, more elderly, because even people who are of mature chronological age want to look nice. Mm-hmm. And having something clunky on your ear, it does detract from your appearance to some extent, at least potentially.
Yes, and like you said, with the newer styles, you can get what we would consider invisible hearing aids. So they sit down in the ear canal, so nobody would even know that you're wearing a hearing aid. Some of the older analog hearing aids also had issues with feedback. So not only were they visually noticeable, but maybe you could hear them, like the squelch of the hearing aids. So with the newer technology, with the digital signal processing, you just don't get that embarrassing feedback anymore.
All right, we talked a bit, Dr. Dice, about veterans, but let's talk about the population at large. How common is hearing loss?
So it's very common here in America. Probably about 30 million Americans at least suffer for some form of hearing loss. And certainly age is a good predictor of hearing loss.
And is hearing loss preventable?
It is, yes, especially in my field, for noise-induced hearing loss, using hearing protection, even just for everyday things that we take for granted, like mowing the lawn or working with power tools. Even some hair dryers can be pretty loud. Driving in traffic. We do live in California, so most of us are stuck in traffic a lot.
We were talking off air, and I think we both have teenage children, and we're in a college community here in Davis with young adults. And I've always been really interested in hearing loss as a public health issue, as long as I've been a physician at least. And I'm a veteran myself, so I was interested when I was in the military and came out and had a little bit of hearing loss that sort of sneaked up on me. And I've tried to instill in my children, who are now young adults practically, teenagers at least, this concept of prevention, where foam hearing protection devices, if you're going to a concert or if you're at a restaurant with a lot of noise or amplified music, or at a swim meet. They go to a lot of swim meets where the amplified announcements are always put up at the highest level. We travel on airplanes. For some reason, the flight attendant announcements are always really loud. Occasionally, I'll even measure ambient noise when we're out on my phone. It has an app, and it'll often be in the range of 80, 90 decibels when it doesn't seem that loud for a lot of our social activities. However, the point I'm leading up to is I don't seem to be able to make much headway with my teenage children. And I tell them this, and they go out to concerts, they don't wear hearing protection, they kind of forget all this advice. And I feel that our efforts as a society to prevent hearing loss could be better, but it's kind of an uphill struggle. Don't you agree?
I would agree. We see that a lot with children, even music. Music's very loud. A lot of people are wearing headphones, earbuds, and it's just so loud that they couldn't carry on a conversation or hear what's going on around them. So we definitely do need to do a better job about educating younger folks, teenagers especially, about the dangers of hearing loss.
And the irony is musicians who really prize their hearing tremendously often are most seriously afflicted by hearing loss. I believe that there was a member of the rock group The Who became an advocate for preventing this, in fact.
Yep.
His name escapes me.
Pete Townsend.
Okay, Pete Townsend.
Yep.
I was thinking Entwistle, but he was one of the other guys. Yeah, he became an activist in this field, right, trying to encourage people to protect their hearing. So we can do better. And I think society is just getting louder. I mean, there are lots of things that exist now. I hate to sound like I'm reminiscing too much about my youth, but For example, when I was young, they didn't have sounds on trucks when trucks backed up. It just didn't exist. Of course, they didn't have as many mufflers, so some things were louder then. But I feel that society has just gotten louder.
I think you're right. We're definitely getting louder, and like I said, everybody's just always connected to their phone. So whether they have a Bluetooth device or they're listening to music, and yeah, it's just a noisy world out there.
So if you screen someone who's, say, 40 for hearing loss at the VA, you know, you're going to have a select population that was referred to you, but do you find usually most people have some hearing loss at that point?
Especially in the veteran population, yes. So typically, you know, as we age, I mean, even as early as 40 or 50s, 60s, and beyond, we'll see some form of hearing loss. And so we usually try to get that in early and maybe monitor them every 2 to 3 years, depending on the degree of loss, fit them with hearing aids, that sort of thing.
And you also manage tinnitus.
We do.
What is tinnitus?
So tinnitus is probably most commonly known as ringing in the ear, but it can really be any type of sound that's not generated by an outside source. So within the VA, that's consistently one of our #1 service-ranked disabilities among veterans. So it's a big focus for us, but I also think in the general population as well. People suffer from it, so they just hear a constant noise in their ear, might come and go. It can be very bothersome for some people.
Yeah, I think I also mentioned off air that I used to perform compensation and pension evaluations myself at the VA, and hearing loss and tinnitus were very common as areas of concern. By the time you get to age, say, 80, how common is hearing loss and how common is tinnitus?
Both are very common. A lot of times, especially in the VA population, they tend to go hand in hand. So it's extremely rare that I'll see somebody 80 or above that doesn't have some type of hearing loss.
Yeah, as a geriatrician, I have the same impression. I have to tell you that I've spoken to colleagues who have looked at this as a cultural phenomenon, and I've had some individuals, even I believe an audiologist in the past, I forget who exactly, say to me that in technologically less developed cultures, hunter-gatherer cultures, that the elderly do not develop this hearing loss, that it's a byproduct of industrialization.
That totally makes sense to me.
Yeah.
Absolutely.
I've wondered if that's entirely true. All right, so we've talked about the importance of this as a public health issue. What do you do as an audiologist to assess someone with hearing loss? What's the routine procedure?
So the first step is doing a detailed case history. So, you know, how long have they noticed their hearing loss? Do they have tinnitus? Have they had any other previous ear problems like ear infections? Do they have a family history of hearing loss? Is there a genetic component there? Any type of noise exposure, that sort of thing. Do they have dizzy problems? And then a basic hearing test. Of course, we check the ear canal for any abnormalities, excessive earwax. We check the middle ear system to make sure the eardrum is functioning properly. We also test for acoustic reflexes. And then we do the basic kind of beep test that everybody's familiar with, so we can assess their hearing acuity. And we also do word recognition testing as well.
So if I understand you, Dr. Dice, you're not just checking for the presence of hearing loss, you're also generating a kind of differential diagnosis. In other words, is this due to a conductive defect in the bones? Is it due to an obstruction by wax? Is it due to damage to the nerves?
Exactly.
And what's the most common cause?
In the veteran population, noise-induced, obviously, and also age-related.
And that's what we would call sensory neural?
Correct,
Okay.
yes.
And so the inner ear we have an outer ear, a middle ear, and an inner ear. And the inner ear, tell us what it looks like and what happens when you get this hearing loss.
So the cochlea, which is our hearing organ, looks like kind of like a snail-shaped device, basically, and you have hair cells in there, and they're kind of arranged by frequency, so low frequency to high frequency. So in a sensory neural hearing loss, we would see damage to those hair cells. So those hair cells are damaged. They're not sending the appropriate electrical signals to the brain, and so you're not hearing very well.
And that can also cause tinnitus, right?
It can, yes.
All right. Let's turn to treatment. We really want to ask, I would like to ask you the question, is there any grounds for optimism? Are the treatments with hearing aids getting better? What do you have to offer?
So hearing aids, like we've talked before, definitely come a long way. They're more discreet, but they also sound much more natural than the old analog hearing aids where just they amplified everything. So with digital sound processing, hearing and noise is becoming better. Listening to music is more enjoyable, that sort of thing. So they've definitely come a long way.
Now, there are some hearing aids which I have seen advertised, both as products and in at least one case as a kind of contractual arrangement for maintenance of a device, which involves actually long-term follow-up. And these are in the canal devices that are effectively almost invisible. Mm-hmm. However, I have been told by colleagues in ear, nose, and throat that a foreign object in the ear canal can also cause chronic problems, erosion of the surrounding tissue. Do you have any experience with these completely in the canal products?
So we do offer completely in the canal products through the VA, and you're right, it does depend. It's very patient specific. They're not for the more severe, profound type of hearing loss, because in that small device you can't get a lot of power out of the circuit without producing feedback. And certainly it depends on the shape of their ear canal. Do they have chronic ear infections? That sort of thing. So they definitely are not for everybody.
If a veteran is interested in that kind of device, say a veteran doesn't want to, or I should say patient, because perhaps in another setting, doesn't want to have a visible hearing aid, does that at least represent an option?
Yes, absolutely. So typically during an evaluation, we'll present them with options and kind of steer them towards what we feel would be in their best interest. But with any hearing device, they do have a trial period because it usually takes them a good month or so to kind of get used to hearing all those sounds again. So if they try one device and maybe it doesn't quite work as well as they thought it would be, we can try something different for them.
So my understanding from looking through this literature a little bit is that historically you had these large devices, then you had behind the ear devices. Now we're moving towards greater miniaturization, at least more of a tendency to offer in the ear devices. Is that a fair description of the progression, more or less?
It is, yes. And then with Bluetooth technology, there's been advancements in newer styles, what we call a receiver in the canal. So part of the hearing aid, the receiver is actually sitting in the canal, but the microphone and the processing is sitting behind the ear, but it's a very sleek, discreet design, and those offer a lot of those Bluetooth technologies we've been talking about.
Is there a connection between the behind the ear part and the in the ear part? Is there two between them?
There's a wire.
A wire.
Yes.
Yeah, I think I've seen a few of these, and they are quite discreet. I wouldn't find them, disfiguring. What does the Bluetooth accomplish exactly? What does that do?
So Bluetooth, depending on the patient, if they are a smartphone user, they can wirelessly connect to the device. So it's hands-free for phone calls, for streaming. And then some of the newer hearing aids that are kind of coming down the pike are not just hearing aids. They can detect when a patient has fallen. They can track your steps, so just like a Fitbit or another type of device that kind of tracks your fitness. So they're becoming not just hearing aids, they're becoming much more than that.
That's very exciting. How about recharging hearing aids? Is that a problem? Is that an obstacle to hearing aid use with these newer hearing aids?
So that's been a great advantage. So as you age, sometimes dexterity can be an issue, so handling a small battery sometimes can be a problem for patients. So with the rechargeable technology, they're able to recharge the hearing aid at night while they sleep and get 24 hours on a full charge.
Is one hearing aid enough, or is it necessary to have bilateral hearing aids if you have bilateral hearing loss?
So we'd always recommend a binaural fitting of hearing aids. You get much better sound localization. You're able to process background noise better, and also sounds more natural.
Okay, I have that same impression, but I have encountered patients who have said, I only want one. Do you ever see that in your practice?
In the VA, not so much, because we don't have to worry about that cost factor.
Right.
But I can see where some people might go that route thinking I just need one, but it's like your glasses. You wouldn't just fit one eye and not the other.
Let's talk about future research. I'm aware that there is some effort to find genes associated with generation of inner ear hair cells. One is called the otoferlin gene, and that the hope on the part of scientists is that with gene research, we might eventually be able to actually insert gene functioning into the inner ear and regenerate the hair cells. And I think you discussed your own research experience in Michigan when you were becoming an audiologist with a colleague who was involved with this. It seems to me that, without being overly dramatic about it, that would almost be the holy grail of hearing loss treatment if you could regenerate the inner ear. Is that a pipe dream, or is that a possibility, Dr. Dice?
I think that could be certainly a reality in the future. I would be interested to see what the applications of that would be. I think for children or somebody with a more recent onset of hearing loss, that could be very promising. For an individual that's had a progressive sensorineural hearing loss over many years, you still have to look at the nerve. So even though they're able to regenerate those hair cells, is that nerve still intact enough to deliver those signals to the brain?
You know, often when I'm dealing with not just patients, but even relatives and friends with hearing loss, I find that there is a real reluctance on the part of individuals to have a hearing assist device of any kind. And this often seems to create a lot of strain, a lot of stress, a lot of consternation, not just for the individual, but for the individual's spouse and family members. And I think that's been described. I remember when President Reagan was in the White House, he, I believe, was responsible for approving some of these health awareness months, not just November Hearing Awareness Month, but October is National Protect Your Hearing Month, May is Better Hearing and Speech Month. So there's been a national governmental interest in this. And I remember that his Surgeon General, C. Everett Koop, discussed a kind of fatigue factor where individuals who come home, in those years largely men from work, would be fatigued and their wives couldn't communicate with them and the husband would tune them out. So can you talk a little about the interpersonal, psychosocial aspects of hearing loss? And if I may, Dr. Dice, can you advise us how we can encourage people to avail themselves of the help that's out there for hearing loss?
Yes, so we commonly see that. I see that almost on a daily basis, where spouses or other family members come in and complain of selective hearing loss, and that certainly is an issue. So it's not just the hearing loss. You know, the brain, we really hear with our brains. So as you go throughout your day, that gets a little bit harder to do when you have a hearing loss. It takes more effort on your part to kind of fill in the blanks of what you're missing. So we even see that with hearing aid users. At the end of the day, they'll say, oh, I don't think my hearing aid's working quite as well. I notice I'm turning up the volume a little bit, and it's not so much their hearing or their hearing aid, it's more taxing on your system to be able to effectively do that. So certainly educating them on the benefits of hearing aids and just getting them to try it. A lot of times once they try hearing aids, they're, wow, I didn't even know I was missing all of this.
Can a non-service connected veteran get any kind of treatment at the VA? It would require going through private insurance, right?
No, so if veterans are eligible for VA care, they are eligible for hearing aids.
Okay, that's very good. Are there any resources out there educationally that either individuals with hearing loss or their relatives could turn to, or any support groups or anything like that? I mean, I don't mean to spring that on you suddenly. Maybe you haven't thought about that, but is there someplace they could go, a website, or I suppose the VA may have some information?
The VA website has some good information on there. The Hearing Center of Excellence, which is a DoD collaboration, they have excellent tools on their website. You can actually watch videos on structures of the ear, what's happening when you have hearing loss. You can even order like brochures and things like that to help.
And for veterans in particular, what is the waiting time like if an individual wishes to go in and get checked for hearing loss? Access is often a bit of a problem. By the way, I should mention I've been a patient at the VA myself, as well as a doctor there, and I'm a huge fan of the VA. I think the VA provides excellent care. It has probably the best electronic medical record that's out there. It has seamless exchange of information from one facility to another via their electronic medical record. And so I feel the VA does a great job in many respects, but my only real problem with the VA looking at it as a physician and having been a patient there, is that access can be challenging. With respect to hearing loss, is that a big challenge for you, getting people in to be seen or responding to the need to evaluate people?
Yes, that's always been a struggle for us, and we're always looking for ways to improve that. We do have open access, meaning they don't have to wait to see their primary care doctor. They can self-refer for an audiological evaluation. Typically, our wait times can be, we strive for less than 30 days for new patients. That doesn't always happen. It might be more like 60 or 90. However, they do sometimes have the option if they are eligible for community care. So that's where the VA would send them to somewhere in their local community for testing.
Dr. Jean Dice, it's been just a pleasure having you here on Health Focus, and I want to thank you not just for educating all of us on this important area, hearing loss and tinnitus, but also for your service to our veterans, which I think is a very high calling. So thank you so much for being with us. Do you have any closing comments or advice for our audience about hearing loss or tinnitus?
Well, thank you very much for having me. If you're a veteran, certainly have your hearing checked. It's always good to have a baseline. If you're not a veteran, have your hearing checked. Talk to your primary care doctor about your options.
Thank you very much, Dr. Dice.
Thank you.
Remember, here at Health Focus, we focus on your health. So as National Hearing Awareness Month is upon us, we wish you all the best, and remember to protect your hearing, because it's so important to all of us and to those around us who care about us. Until next time, this is Dr. Scott saying thanks for joining us on Health Focus, and stay healthy. Bye now.